have any sound.
All right, there we go. I'm Bill Blackburn, Kerrville Mayor, and we're bringing you once again a community update to let you know about, from a variety of sources in the community, what's happening with the COVID pandemic and how that is impacting us locally. I have some opening remarks, and then I want to share with you just some observations, and then we'll move on to different community leaders. One of the things I'm seeing is that there is a combination of anger, frustration, and fear in our community. And I'm probably not telling you something that you don't already know, but I'm thinking about this. Some fear or anger rather in regard to government mandates, including the wearing of masks. Having to wear masks at work when people do not want to do that. Anger that other people are wearing masks. That the virus is spreading because people are not taking precautions. Those are some of the factors in regard to the anger. And the frustration, just the inconvenience of this whole thing, and not being able to circulate as we normally would. The fear because of businesses that are in danger, people that are out of work, and the fear about the illness. And every time we turn around, it looks like it is increasing, it is spreading. And so in the midst of all that, I would suggest we come back to Kerrville kindness. What is Kerrville kindness? It's going out of our way to help someone else. It's love thy neighbor. You may be angry that someone is wearing a mask, but you don't know their story. You don't know why they are. Let's cut each other some slack. Let's dial it down a notch and just live and let live and care about our neighbors. I think that's vitally important. Now, one other thing, I had a meeting last Thursday, of 10 businesses in the community, from a nail salon to a discount center to a convenience store chain to dry cleaners and more. And I was asking them, and I'd invited an infectious disease specialist to be there and hear this. I invited them to talk about what they were doing to prevent the spread of this virus. And it was fascinating and encouraging to hear what they were doing to protect their customers, to protect their staff, and ultimately this community. And so there are folks out there that are doing all that they know to do and can do to really make a difference in the time of this pandemic. And I am deeply appreciative for that. At this time, I'm going to ask Chief Danny Smith of the Kerrville Fire Department if he would to share with us an update. And then we're going to go to the county judge and then to Peterson Regional Medical Center. Okay, Chief.
Thank you, Mayor. Good morning to you and good morning to the citizens of Kerrville. I'll just start my briefing with some information on COVID-19 and the status in our community. As of today, the latest numbers just prior to us starting this meeting, we're at a total case count for COVID-19 of 219 cases in Kerr County. Of those 219, at this time, 138 are considered active. There's been 2 deaths in Kerr County. The Peterson has 5 hospitalized at this time as a result of COVID-19, and we have 79 that have recovered. There's been a lot of questions regarding COVID-19 to the city if our probable cases are actually counted in our total case count. And the answer to that question is yes. And let me provide a little explanation of what probable means. Some individuals that share households with confirmed COVID-19 cases are considered by DSHS as probable. And those probable numbers are included in the total case count for Kerr County of 219. We've gotten some additional questions to the city regarding why does Peterson and the city's numbers differ from DSHS? And I provide you this explanation. There's been a tremendous increase in the amount of testing done by the city, by Peterson, by DSHS. But in an effort for the city and Peterson to provide our community with the latest and most updated information, our information sometimes is ahead of what DSHS is providing because there's a lag from DSHS based on the sheer volume of testing that they're doing across the state of Texas. So what you see coming from Peterson and the city is going to differ from DSHS, and that's simply because we're trying to provide our community with the latest information we have available to you. And as a result of that, we ask your patience because as the information changes hourly and sometimes by the minute. Finally, there's in the original Open in Texas document, you may recall that the city was allowed to open up at a 50% capacity because at that particular time, our county had less than 5 COVID-19 positive cases. There was some criteria placed on those counties that were allowed to open at a 50% capacity and actually placed on our counties. But basically, the thresholds that were identified was if you reach 5 consecutive testing or tracking intervals with a positivity rate greater than 12%, then that county would have to revert back to the prior numbers. Right now, we're at 70. If we hit these thresholds, it means that we'll go back to 50% occupancy capacity in our restaurants and some other businesses. An additional benchmark placed on the counties by the state was 3 positive cases per 1,000 residents. And then finally, less than a 15% surge capacity in hospitals for the catchment area that's available. Right now, we appear to be doing okay in the 12% positivity rate across 5 consecutive intervals. And Peterson will speak to this a little more, but the surge capacity doesn't seem to be an issue in our hospital. Right now, the benchmark that we're approaching that may affect us is the 3 positive cases per 1,000 residents. That number would be 152 for Kerr County. Right now, we're at 138 active cases. In addition to that, I want to share some information with you that the results of our National Guard COVID-19 testing that took place on July the 2nd, that testing resulted in 541 COVID-19 tests in our community. Of those 541 tests, 419 were actually Kerr County residents, and it produced 49 positive test results for Kerr County. We have scheduled to bring the National Guard back on July the 14th. That's been confirmed. It will happen again at the Dahl School Community Center. Time is going to be from 8 a.m. to 4 o'clock in the afternoon. The criteria to be able to test it, to get tested in that process has changed a little. Let me back up. Not a little, it's changed a whole lot. You will no longer be able to just walk up and get tested. You will, for the 14th testing at the Dahl, you have to pre-register. We'll make the pre-registration information available on the city and county's website and through social media, but that information and the opportunity to register will be provided 36 hours in advance. And you will have to register online. The website to register will be texascurativeinc.com. All one word, TEXAS, curative, CURATIVEINC.com. I'll repeat it once again for you. Texas, TEXAS, curative, CURATIVE, Inc., all one word, .com. In the previous testing that we've done with the National Guard, there was an option to call in and register. That's not going to be available for the July 14th testing. And the previous tests, we conducted 541 tests. The National Guard likes to cap that testing opportunity at 500, but for this particular day, that testing opportunity is going to be capped at 250 because they're going to be bringing a reduced number of personnel in comparison to what they had in the city on July 2nd. So it's going to be capped at 250, first come, first serve, and you will have to register at TexasCurativeinc.com, TexasCurative Inc.com. And that concludes the information I would like to share with the community today, Mayor.
All right, thank you, Chief. And at this time, County Judge Rob Kelly.
I think I got it unmuted. Good morning. I really don't have much to say. I think I'm suffering from what I call COVID fatigue. I think this thing is kind of an insidious effect on us and just kind of wears us down. And I find sometimes I get to thinking a little foggy. But the last couple of days, I've had some concerns about where we're going with all this. It seems like to me it's quite a daunting task for us to try to navigate the micromanagement maze that the state has put down for us to try to figure out how to help the public, which is very frustrating for me. And I know it is for you too. But there are things that we have to still do in order to remain safe. Some of the things that we're doing work and some of the things that we've been doing haven't worked. For example, with regard to enforcement of any of these orders that have been put in place by the governor or even by the local officials, it's all voluntary. And you've heard, I'm sure you've heard our sheriff's comment that he's not going to enforce any of this, which just makes it more difficult and more frustrating. And somehow or another, we have to find a way to come together and overcome our differences and work together to try to protect the public welfare. And so one of the things that I'm struggling with, I'm really struggling with two things. The governor has given us certain powers. And one power that he has restored to us is regards outdoor gatherings. And any gathering of 10 or more people has to be approved by either the mayor if it's in the city or the county judge if it's in the county. And that was amended from previously, the governor had it at 100 and he reduced it down to 10. Now I have to ask myself, why did the governor reduce that? We don't have a good explanation, but it's pretty clear to me that 100 was too large. And so for those of you that are curious about what I'm thinking or where I'm going to come down on this is if 100 was too much, then presumptively that would be the most that I would ever approve at this point until I can be shown that we can do it safely. I think we need to reduce the size of the groups that are gathering. The other thing that I do have that I'm considering is the size of these events out at the Hill Country Youth Event Center. That's a great facility for the public to gather, and the county's been very proud to make that available for nonprofits as well as a lot of other activities out there. But the capacity at Youth Event Center is 1,000. And so at 50% capacity, that's up to 500 people, or if you're talking about 75% capacity, that's 750 people. And a lot of these events serve alcohol. We have problems with security. I'm not convinced that we should have those large events that serve alcohol out at the Youth Event Center during this time of COVID-19. So I'm considering what we can do about that. Now that is a county-owned facility, and it's not like other establishments. As you know, we can't tell a business or a restaurant or a hotel or anybody the capacities. The governor has laid that out, and there's a formula for them to compute what that is, calculate what that is. But at the county facility, I'm considering whether or not the county ought to revisit its policy on what kind of events we want to have out there and the size of those events until these numbers change. And the numbers that I'm concerned about is I can tell you for a fact that on May 1, we had 5 total cases, and I think we had 2 or 3 active cases. And I filed the attestation with DSHS to be able to open up to 50% capacity, if you recall. And you heard where we are today. on July 9th, we've got 219 total cases and 138 active cases. And I'm concerned about that because when we reach the magic number of 152 active cases, then there's going to be an automatic rollback in our open capacities. And also discretionary for the governor to take it back even more. So where I'm coming from on all this is we need to kind of overcome some of our differences, in my opinion, try to work together. And if strongly recommending mask is the consensus, then let's cooperate with that. And if you don't want to wear a mask, nobody's making you wear a mask. If you want to wear a mask, please do, and encourage others to. And don't bicker and squabble about it. I've got all kinds of reports about confrontations in HEB. This is a time for us to come together for the common good. And so with that, I just want everybody to stay safe and know that the county's looking at what our options might be to try to protect everybody a little bit better. And that's all I've got, Mayor.
Thank you, Judge. Let's go now to Corey Peterson. Sure, Corey Edmondson, who is the CEO of Peterson Health. And give us a report, please.
Thank you, Mayor, and good morning, community. Bear with me as I go through my report. This may be a little bit longer than what you've had. There's just so much to share, and I'll try to get through it in a rapid pace. So I'm just kind of giving you a heads up. Lots of questions that have come through that I'm aware of, and I will try to get those addressed in my report this morning. First of all, let's talk about the number of tests that have been completed. And Peterson has tested well over 2,600 times, or 2,600 tests. But we all know that there's been more than that, because that's just what Peterson controls or manages. We know that the Texas National Guard has tested. We know that other communities or other entities in the community have tested, et cetera. And we know that probably well over 4,500 tests have been completed, but we don't always get those results. So we report on what Peterson manages. But even at that, you'll look on the Texas Department of State Health Services website, and you'll see through July 7th, the state only says that Kerr County has only tested 3,175. What I need you to get out of all of this, and it's been alluded to already, is that the state's behind. And between Peterson, the city, and the county, we're given the most updated numbers and recent data on the website, and so it's accurate from our perspective and what we know to date, and it's going to be even more relative and relevant to what we have today. But I just want to reemphasize that on the testing side of things. Moving into that testing is we're continuing to test at Peterson Urgent Care Center, and early on in this process we were testing up to 30. Now we knew that there was an increase in a capacity need, so we added more staff to that, and now can test up to 60 a day. And now we are hearing we need even more capacity because people can't get in same day to test. That's resource intensive, and we're doing our best to mitigate that and try to add more staff over there. So hopefully within the next period of time, not sure when that will be, but we hope to add capacity to Peterson Urgent Care Center. The tests that we do there are sent to the state and to our lab that we contract with, and whereas we were getting roughly 24-hour results, now those are extending out to several days, and that varies. And the state even experiences that as well on their end. There are tests out there that are called rapid tests that can be done in 15 minutes to 45 minutes. We've ordered those tests and have ordered those platforms months ago, but those are being rationed, and really rationed to depending on what vendor that is, to larger communities for testing. We're hoping to get those. They say we're going to get those, and if we do, we will put them in our clinics to be able to test quickly. But depending on what vendors are used out there, Abbott is one that you've heard of. We use Abbott, but they are limiting who has those rapid tests. We hope to have those soon. We just don't know when. So we are getting results as fast as we can and report accordingly. Moving on to the total number of positive cases. You already heard that there's 219, and for the record, those cases do not include antibody tests. They are strictly positive COVID-19 tests that have been completed. They do include probable tests that the chief already mentioned. So that we're including that in our total case count. Chief already told you that we've had 5 patients in the hospital, and we are treating those, and that increase, that's the most that we've had at any given point in time, and actually could have more after we get some results today. We're seeing an increase in total admissions for COVID patients. We're able to handle that. We have the capacity to handle that. We're not concerned about that at this given point in time. But we are concerned that if it continues to increase and evolve, that we may reach that capacity, but there's not a fear of that right now. We ask that you do your due diligence and try to mitigate that so that you don't overwhelm a health system like what they're experiencing in San Antonio with volumes of patients coming in. In fact, San Antonio has reached out to us, and there may be a transfer coming this way for patients for us to take care of their patients. We're able to do that, and we're ready to do that, and are willing to do it. We haven't received that yet. We've just been put on notice that may be the case. The positivity rate that you're seeing right now has increased, and that's what's well informed. But to get an exact positivity increase changes from day to day, and depending on when the test was done and when you get the results and all that, to give an exact number is tough. But I think between the city and the county and Peterson, we have a sense of what that is and have reported accordingly. I think bottom line is that we know there's been an increase in cases. There's been an increase in the need for testing, and we're all trying to work towards managing that environment. A few important reminders at Peterson. We re-emphasize our visitation restrictions where we're making adjustments based on who's been able to come into the hospital and who's not. And we're using guidelines from the Department of State Health Services in regards to visitor restrictions. We know that's difficult. Our staff is trying to work with patients and their family and communicating. And I believe our nurses and our staff and doctors have all stepped up and communicated accordingly, are doing a fantastic job with additional warmth and attention to our patients to ensure that they feel like they're getting that exceptional care that they've known to have. The COVID hotline continues to stay open, that you're answering. You can call the hospital's number and press 1 and get answers, but we've been overwhelmed with the volume of calls that have come in. We've added staff to that as well, just to answer the community's calls. The concern that I have overall, and you're hearing it on a national level, is people are refraining from accessing healthcare. They're not calling the ambulance if they're having a heart attack, or they're not accessing their physician if they're not feeling well, their diabetes is up. Because they're scared to come into any medical facility for fear of catching COVID. I heard a story the other day that a nurse that was working, and we were talking to in another area of the country, said they got asked the same question, and I reiterate this: is your healthcare facilities are probably some of the safest to go to because they're the cleanest and they're the most diligent in making sure that they're taking all the mitigating factors to reduce the rate of infection and access and all. In fact, Peterson Health, just for the year, we rated in the top 10% of the hospitals in the country for cleanliness based on results that we have. Our facilities and our doctors are all experiencing the same thing. Everybody's wearing masks, and you're going to be cared for. Don't cancel cases. Don't cancel going to see your doctor. Make sure that you're getting your health care, because we've seen a dramatic negative impacts on people's lives in healthcare because they have restrained from going to the doctor. I want to re-emphasize CDC guidelines: washing hands, social distancing, wearing a mask. All of those are good mitigating factors to controlling this virus and the outbreak. We've gone to an all masking facility wherein our nurses were already doing that early on, but now all non-clinical people are wearing masks, and all visitors are wearing masks. You're seeing that and in our facility, and we strongly encourage those in the community, when you're out and about, to wear a mask. We know that it helps reduce the effects of COVID-19 and passing it from one person to the other. I would say, just in conclusion, overall, that when you see us at Peterson and you access our care, we're smiling behind our mask. And I encourage the community to smile behind their mask as well. Judge already reiterated, and so did the mayor, that we got to get back to some friendliness and kindliness and some grace with each other in dealing with this. We're all stressed to the max. I know here at Peterson, we are tapped out. Our staff is doing a fabulous job in managing this, and they're on their toes every hour, every minute, trying to mitigate and anticipating what's going to be coming through our doors. And as more positive cases come about, that increases our need to continue to step up and add resources to take care of this. We're continuing to meet our mission of exceptional, compassionate, patient-centered care, and we remain vigilant and prepared, and making adjustments daily as needed and adapting to the needs of our community. So we ask you to visit our website for updates, listen to our daily 4:30 video and audio about what the updates are, and certainly reach out to us if you have any questions regarding COVID-19. That's it, Mayor. Thank you.
Okay, thank you, Corey. Before I go to Charlie McIlvaine and then to Gil Salinas, I want to say that Mark Faust, Superintendent of Kerrville Independent School District, could not be with us. He was with us earlier in conference, and he has encouraged people to look at the KISD website that I think was posted just last night, the information about return to school this fall. As I remember, he said it's about 7 pages, covers a lot, but take a look at the KISD website for that information about school starting in the fall. All right, Charlie.
Thank you, Mayor. We are continuing to see travelers visit Kerrville for a number of reasons. One, we are a drive destination, and two, we are perceived as an outdoor destination with a healthy environment and space to spread out. We are not seeing the number of visitors that we normally see in our community. In fact, our visitor numbers are down approximately 50%. We are much better off than a lot of the larger cities. We don't have to depend on airlift or air traffic to enhance our visitor count. One of our most frequently asked questions from visitors is the river open? Visitors enjoy the same quality of life amenities that we as residents enjoy on a continual basis. Amenities like aquatic activities in and along the Guadalupe River, park improvements, the river trail, unique shopping opportunities, excellent dining facilities, theater arts, museum and fine arts exhibits. And even though most of our visitors do drive in, we have an exceptional municipal airport. Visitors stayed in our hotels, cabins, inns, and bed and breakfast facilities. In June, 83% of our visitors were from Texas. 38% were day visitors and 30% did stay overnight. Where do our visitors stay when they are in Kerrville? In June, 73% stayed in hotels, 25% stayed in RV parks or campgrounds, and 2% stayed with friends and family. I do want to update you on a couple of visitor activities. Number one, youth camps. The camps are in session and most are operating at close to full capacity. Camps are operating on a shortened season this year, and campers are spread out and they are adhering to very stringent guidelines established by the governor's office. Campers are practicing social distancing, sanitizing often, washing their hands multiple times a day, and staff and campers are wearing masks. The sports complex. Kerrville and DPAT did host a tournament over the weekend. New health and safety protocols are in place, including social distancing, hand sanitizing, and masking. And third is small meetings and weddings. A wedding was held over the weekend in one of our local hotels. And again, stringent guidelines were established and guests were 100% compliant. Large ballrooms were utilized with only 25% capacity allowed in the ballroom at any given time. Monitors were posted at the doors using counters to determine how many guests entered the facility, and as guests exited the ballroom, those numbers were also tracked. So the hotel knew exactly how many guests were in the ballroom at any one time. We do continue to see events canceled, and we will continue to see events canceled or eliminated. Events that are taking place are closely monitored with every conceivable health and safety check in place. The hospitality industry creates jobs. In fact, the hospitality industry is the second largest employer in Kerrville, second only to the medical industry. And during 2019, 1,700 jobs or individuals were employed in Kerrville and Kerr County in the hospitality industry with earnings of almost $45 million. Two market segments that experienced activities over the Independence Day holiday was the motorcycle market and the RV market. Kerrville had several motorcycle groups and numerous individuals in town with their motorcycles. RVers are also in Kerrville and Kerr County over the weekend. Kerr County has more RV spaces than hotel rooms, and many RVers took advantage of the long holiday weekend to visit our area, enjoy recreational activities, relax, and get away from home for a few days. Tourism is a vital cog in the economic recovery process for Kerrville. And fortunately, we have many positive components that help drive that recovery. We encourage everyone to help restart our economic engine. Stay safe as you explore Kerrville with a brief staycation right here at home. You can check out activities with our website, Kerrville, Texas, CVB.com. Thank you, Mayor. This concludes my comments.
All right, thank you, Charlie. Now we go to Gil Salinas of the Economic Development Corporation.
Thank you, Mayor. At the last COVID update, we at the KADC mentioned how we were shifting our efforts to reopening the Kerrville economy. And that was a huge step in the direction of just stabilizing our local business atmosphere. And that was more than a month ago. The unemployment rate at that time was near 12%, the highest it had been in recent history. The most recent numbers, which came out this week, we're now at 10.1%. So we're just a decimal point or 2 decimal points away from being back to single digit rates, which is, what most communities, cities, regions, counties in the United States wish they could say they would be at. This shows that we're making progress and we continue to be lower than the state and the national averages. Now, as far as sales tax allocations, those numbers were released by a state controller's office. If you recall, a couple of months ago, we have reported that there was a 2.8% decrease in sales tax allocations, which was not as a significant hit as we had originally anticipated. Then last month, we had reported that there was a 7% increase in sales tax revenues, which was very well received. And just today, the new numbers were released by the state controller's office. So now we're at 11% increase in sales tax revenue. So really from 2 months ago when we reported this, we're a little over 15% up on sales tax revenues. And then that's on par with what we've been encouraging and promoting as far as shopping local, what Charlie was just mentioning as far as some of the visitors that we're seeing. Again, it's encouraging to see that there's stability, and it shows that we are an economic hub in the Hill Country. We've grown over the years, and we truly do have a diversified and a resilient economic base. At the Kerr Economic Development Corporation, we continue to work on the same strategy. We're tweaking that strategy, which is reopening the Kerrville economy and keeping it open. And again, shopping local, if you are going to order online, order from some of our local shops. They also have online options. Let's do our part to keep people employed and keep our entrepreneurs busy. Now, in closing, KerrvilleTogether.com. Log on to that website. There, it's a collaboration between different entities. You can find a lot of information about the state programs, federal programs. This applies for small business owners, large businesses, large industry, and also for entrepreneurs and job seekers. If you are a person who's looking for a job, you can go on there and you have access to all these different state programs, Texas Workforce Commission, Workforce Solutions. Now, be mindful that unemployment funds are in all likelihood going to start getting decreased here in the next few weeks or later this month. So please do your best to prepare for that situation, anticipating that there might be a decrease in that. So again, Kerrville economy, we're doing better than expected, but we still have a long way to go. Let's continue to support our local shops and do our best to keep Kerrville Main Street alive. And like the mayor in his opening, he said, let's practice Kerrville kindness and be respectful to others. Thank you. Back to you, Mayor.
All right, thank you very much, Gil. Do we have anyone else that has joined us on this broadcast? If not, that concludes this community update. Again, let's practice Kerrville kindness.
Yeah,
All
I've
right.
got a comment before we take off if we can.
Okay, Chief.
I just
Okay.
want to make a correction on some information I provided. I said that we were at 70% capacity in our restaurants and other businesses, and that's actually 75. And then we're going to get it up on the website, but the correction on the web page to actually register for testing at the DAL is Texas TXAS.CurativEnc, CurativEinc.com. And we will have that information on the website.
You got it, it was just brought up to us, so thank you, and we will look for that correction. Once again, let me just say that part of the issue of our stopping the spread of this virus and really taking the precautions we need to take in order to do that has safety and health issues, but it also has very serious economic issues for Kerrville and Kerr County. So we need to work together and work hard on this. Thank you very much. Stay safe.